Hello, everybody. Thanks so much for tuning in to the live today. On the show, we have a youth icon. She's a young woman who's been on the front lines during these COVID-19 times that we're all going through. She's a senior resident pediatrician at the ESIC hospital in Delhi. And besides her work as a doctor, she's also engaged and involved in very closely as the founder and president of the Every Infant Matters NGO. That is her brainchild. Thank you so much, Dr. Radhika Batra, for joining us.
Thanks a lot for that introduction, and thank you for having me here. It's a very big honor.
Thank you. So, Radhika, I can imagine how exhausting your work is as a doctor, as a pediatrician, and that too during the pandemic that we're going through. So, how do you find time, and what really prompted you to start your NGO work, Every Infant Matters?
Yeah, so of course, the last many months have been overwhelming in so many aspects, be it physically or emotionally, or, there's just a lot of fear and trepidation in all of our hearts. But one of the things that actually helps me fight through that fear, that anxiety that comes with working in a hospital in these pandemic times is the charity work that I do. And somehow in the months of the pandemic, that's just multiplied a lot more. Like it's grown a lot more because we've engaged massively in a lot of COVID relief. So that is a very the feeling that I get that I'm actually helping a lot of people. I'm helping my own fraternity by giving protective equipment, donating protective equipment to a lot of hospitals all over the country. So that really helps me fight through the pandemic. And when it comes to the non-profit in general, the motivation to start something and to reach the poorest of the poor and provide that last mile linkage of health services, I think it comes from a very deep-rooted desire to actually help everybody who is very helpless. There are a lot of patients that come to the hospital who are clueless about what is to be done for their child. And there are many children who die because of preventable causes, very, very easily preventable by a simple, timely, cost-effective intervention. So, when I was in residency, this somewhere affected me on a personal level. That's something we could have easily prevented by a vaccine or by a timely referral or by the availability of a machine like a ventilator. Children are dying because of that. Or if they're not dying, they're becoming irreversibly blind or disabled. So I just wanted to change that, and that is what Every Infant Matters is all about. We envision a world where no child has to die or live a life of misery or blindness, especially when it can be prevented. So that's what is the vision of Every Infant Matters.
It's a beautiful thought. And I understand, Radhika, you worked in Indian communities, you worked with Africans. What kind of work is Every Infant Matters engaged in?
So we are now currently working across 4 countries and 3 continents. So we are doing, we have projects going on in India, in Nigeria, in Kenya, and also in Dominican Republic. So basically, our flagship project at Every Infant Matters is giving children vitamin A to prevent them from going blind. And this is something which I saw a lot when I was doing my MD. That a lot of children were becoming blind because of something, as trivial as vitamin A deficiency. I would call it trivial. I don't think that's the right word. Like something so easily preventable. It's like 2 drops of vitamin A, which are given in 2 doses, 6 months apart. And this is something that all of us who can afford a healthy diet, we get naturally from our diet. But because these children, they don't have, eggs or milk or butter. They are surviving on meager scraps of poor quality rice and, just very poor quality food. So for them, it becomes into such a big problem that it can cause irreversible blindness in these children.
Right.
So, to prevent this, we've been giving the vitamin A to children across these countries. And so far, we've prevented 27,000 children from going blind because of these causes. Because, these are the countries, be it India or Nigeria or Kenya, where poverty is at its worst, malnutrition is at its worst. So There are all kinds of nutritional deficiencies, and not only do they cause blindness, they cause an increased susceptibility to infections, because of
Right.
which children can die of contracting, a chronic diarrhea, or just something which is very debilitating, but would not be debilitating in the scenario of a non-malnourished, like a healthy child. So,
I,
so we're trying to, give a sort of a holistic health approach to these children, where we are not just giving them vitamin A, but we're also improving their immunity. And that's of paramount importance, specifically in today's scenario where the world is reeling under the pandemic, and vitamin A deficiency just makes it so much more worse and makes them so much more susceptible to succumb to COVID-19.
True.
So,
In
yeah.
fact, Radhika, the scale of the problems that you are trying to fight, even before COVID-19, was so huge. But now with the pandemic, it's kind of, it's made everything worse, hasn't it? And you
Yeah.
worked very closely with people during the COVID-19 pandemic. You continue to do so. You've been supplying essentials, food and water to marginalized people. You've been supplying protective equipment, like you said, to doctors
Yeah.
shortage. I believe you're doing that now. So, can you share a bit about your COVID-19 experience, the kind of work you did to help others, and did you ever feel overwhelmed by the scale of the challenge that you were facing?
So, I think when the pandemic started back in March, so as someone who is actively involved in the non-profit world, even before the pandemic, I really wanted to do something in COVID relief. So I started off at a very small scale that, masks and sanitizers are the need of the hour. So we started distributing masks and sanitizers to the slum children and to the disadvantaged children in slums of Delhi. And that's how we started off with the pandemic, with the COVID relief. But as the lockdown happened and as the pandemic just, exploded, I would say, we realized that, hunger is a bigger problem, in fact, than COVID-19 for these marginalized communities, because they've lost their jobs, they're not getting paid, they're migrant workers, they're away from their hometowns, and they don't have a way to get food. So then we started distributing grocery kits. So we made a kit. We made a sort of a COVID care package where we put, 20 kgs of rice, 20 kgs of atta, four types of pulses, a bar of soap, for hygiene purpose, and a little bit of sugar, spices, salt, and oil. And we distributed these kits to a lot of families in the slums in India. Then I got calls from my partners in Nigeria and Kenya as well, and they were like, over here the problem is not just about the groceries; it's on another level altogether. And what my partner in Kenya told me was just horrifying, because he told me that there are these girls here of the ages 11 to 17. And ever since the lockdown in the country, the poverty has increased so much that they don't have the money to buy sanitary napkins for themselves. They don't have the money to afford the Wi-Fi for their education, because all the education is now done online. So they are having to engage in transactional sex. They're having to engage in sexual activities to earn money to pay for these commodities. So this was very horrifying for me, because sanitary napkins is something which all of us take for granted. We don't even think twice about something as essential as sanitary napkins, and that's not being provided to them, and they are having to indulge in such horrifying activities to get these items. So then we did a huge sanitary napkin distribution drive as well. So in the slums of Kenya, there's a slum called Kibra in Kenya, which is the largest slum in Africa. And over there, we've been distributing sanitary napkins as well as the grocery kits and the food items. So that's our work with the disadvantaged. And of course, being a doctor, one of the biggest needs that I saw that the fraternity needs is protective personal equipment. And of course, the government is trying its hardest and best to give us the kits we need and the equipment that we need, the masks that we need. But it's always helpful to send more and to give more as much as possible. So then we've been distributing the hazmat suits, the overall the coveralls with the shoe covers and the N95 mask, and we've given around 5,000 of them. Is it? I think it's 4,000. I'm sorry. And we've given them across 7 states of India to all the major COVID hospitals. You know, be it in Maharashtra, be it Sion, be it Cooper Hospital, all the municipal hospitals in Bombay who are treating COVID. Then there are a lot of the hospitals in Karnataka who actually had a lot of PPE crisis, and we got, I got calls from the residents that, ma'am, please send us PPE if it's possible for you, because we need more and more and more. We need so many kits a day, and as much help as you can give will be beneficial to us. So we sent them to Karnataka, to Rajasthan, to Manipur. In fact, in Manipur, there is a group of nuns. There's a missionary group, and they've been doing the COVID work and the healthcare work for these communities in the remote areas of Northeast, in Manipur and Guwahati. And over there, they had absolutely no, personal protective equipment. And then because they're a sort of a non-government organization, they are just volunteers, and they needed all the help that they could get. So we sent them a huge amount of PPE and masks and sanitizers as well, and face shields, face shields for the protection. So yeah, so we've done, I think, a significant amount of work in COVID relief, and there's still a lot more to do, because I'm trying to arrange more funding for those sanitary napkins for those girls, because there are at least 10,000 women in those slums who need sanitary napkins every month. So this is a problem which is an ongoing issue. And until the pandemic settles and some sort of solution is found for their jobs and their poverty, so it's going to go on. So we're still continuing with these projects, and I'm hoping for some funding and some help to come from abroad and from India. So I'm just keeping my
Okay.
fingers crossed that I can get
I'm
that.
sure
And I
you're
can
doing
help,
great work.
then I can help these girls, in whatever way they can, or
True.
whatever way I can. Yeah.
The story you shared about the African girls was really poignant, and it chokes you up thinking that you have so much that you take for granted, and
It's
these
just
people have to.
horrifying. Like, I couldn't sleep for a whole day, for a whole week. It was just very horrifying. And then I found out that why just in Africa, yeah, in our own country, there's a group of
True.
domestic workers in the Northeast. They're around, again, 10,000, 20,000 marginalized women who are using, in fact, they're using mud for their menstrual purposes, and that's just so dangerous, because it can give them heinous infections and sepsis, and it's just horrifying. So menstrual products are also a very big need of the hour, and this
I
is
see.
also something which we're trying to work in now. So
That's true. In fact, Radhika, it's great that you can make a difference to this world, and you're determined to make it a better place. And it obviously it must give you some kind of relief at the end of the day to think that you've done your bit. So that's great. And it is.
yeah, it does. It makes me happy. It's just that, so when these people, they get what they need, and it helps them. So they are so grateful. They're full of gratitude, and that gratitude is overwhelming.
I can imagine.
Yeah.
You're talking about funding. Is it easy to raise the funds? Do you feel that people are forthcoming?
So I think in the beginning, when the pandemic started, at the time people were of course very eager, to do their bit and come forward. So we did a lot of crowdfunding over Instagram and Facebook, and we received a lot of funds back then. But as it's becoming a part of everybody's life, it's getting more and more difficult to arrange funding, and because I mean, you can't even blame them. Everybody is suffering. The economy is at an all-time low. So to actually get funding for charity purposes is, of course, a task. So I've been putting in a lot of money from my own side as well. But I'm just hoping for a couple of donations, a couple of grants which we've applied for. There are a lot of COVID grants which are coming up, and
Okay.
we keep an eye on those grants and we apply for them. So yeah, all fingers crossed.
Yeah, fingers crossed, and I hope you will get you're doing good work. So I
Thank
hope you
you.
are it. Radhika, I just want to shift to a slightly different track now, going on to your work as a doctor during COVID. As a young doctor, at such an unprecedented time, when the pandemic was spreading across the world and when it finally came to India, what was your first thought?
So my first thought, was that I'm gonna get it and I'm gonna come home and my family is gonna get it and my father is 65, he's a diabetic, and my mom is 61. She's also got a respiratory issue. And my first thought was that how will I live with that guilt, that I contracted the virus because I was working in the hospital, and obviously, that thought will come that maybe I wasn't careful enough, and had I been more careful, then I wouldn't have contracted it, and then my family would not have to have had to suffer on my part, on
I
because of
know.
me. So this was the first thought which came in because all of us are working as doctors in COVID hospitals, in fact. So it's very it was very difficult for me to get over that anxiety of losing loved ones and of losing that that spirit of uh, care that comes with being a doctor, because all of a sudden, it wasn't just about yourself. Like, as a doctor, I have been exposed to all kinds of deadly diseases all my life, be it HIV, be it all kinds of meningitis, pneumonia, all kinds of ghastly diseases we've been exposed to. But then, the risk was always to yourself. It was never like that you'll come home and you'll
Right.
give it to your family even when you don't want to. And you're going to take the whole family down along with you. So that this was something which was very new. It was just, it was frightening. That's the only word I can use.
Huh.
Yeah.
I can
And
imagine.
all kinds of ideas come into your head, like you're trying to cope with a new thing, which is a curveball which has been thrown to you. So, first I thought I'll shift out of the house, but then, I stay in Delhi. Delhi is unsafe for women. You can't really stay alone.
Hmm.
Then, you can't really isolate yourself in a house because
True.
that is emotionally not a very good idea, specifically
Correct.
when you're undergoing these emotions of anxiety. And,
Correct.
so there are a
Okay.
lot of things which we tried, which weren't very uh, good ideas. But at the time, it was such a mode of desperation. I would say, ki we'll just do anything to protect ourselves. That was the
I
uh,
know.
issue that we were facing. And
I,
there are my colleagues. They have small children, and
hmm.
there are doctors who have, like, cancer patients as parents, and parents who are immunocompromised, uncontrolled diabetics. So all of us used to talk, and we used to just think, that our profession used to be something which used to give us so much happiness and so much satisfaction.
Yes.
All of us were so dedicated to our work, and all of a sudden that happiness has just been sucked out of the whole thing. And we used to be so eager to treat patients, to go the extra mile for patients, and now we are actually scared of everything that we're doing. It's not that we're doing anything less. We're still working the same. We're doing the exact same things we used to do. Of course, with a little bit of more caution, but there's always that fear, that,
Yes.
oh God, what if this patient, like, suppose, like, as pediatricians, you get a lot of blood and a lot of body fluids on you. It's a part of your life as a pediatrician. But now, all of a sudden, if that happens, if a child vomits on you, or there's a blood spurt on you, you suddenly think, oh my God, what if this is a COVID patient? And then you spend the next 7 days in anxiety, and you try to
Yes.
isolate yourself in a room, and you try to stay away from the family. But it's not all that possible. So it's become very difficult
It's
for all of us.
really, I mean, I'm hearing this directly from a doctor. You don't get to hear these stories often enough in the media because you don't want to create panic. But yes, we take the word frontline very casually, but it's literally the front lines where you're risking your lives.
Yeah, yeah, it
And
is. It is because so in a way, like, we were never trained for this sort of a scenario. Like, a pandemic has come into the world after 100 years. So
True.
none of our teachers, none of our seniors, nobody had ever, even expected that such a day is going to come, that we are going to be scared of what we're doing. And, I think I speak for everyone that initially, even though we were scared, we never really stopped doing what we needed to do. Be it for a patient who came with breathlessness or, like very obvious signs of COVID, even then, none of us took, a step back or at any time thought ki we won't do what we're supposed to do just because this patient might have COVID. So this is something which I noticed amongst my peers and my colleagues, that nobody really took a backseat. Even my father, who's
Yes.
65 and he's
Yes.
a diabetic. So we told him, please sit at home, please, stop seeing patients. And my mother, she's a surgeon, she's an OBGYN surgeon. So we told her to stop operating, but none of that happened. They're like,
I know.
it's
You
not
were
going to happen.
telling me.
And
Hmm.
all the senior doctors have worked throughout the pandemic. They're still working. There are doctors who are 75, 80, not 87, in their 70s who are still
Yes.
working.
Yes.
So, nobody has really taken a back seat like
I
that.
know.
So that is
I know.
something which I've noticed. And in
It's
fact, yeah, I'm so sorry. I was
carry on. No, it's all right. In fact, you were carry on.
I was saying that a lot of my friends and colleagues have actually contracted the virus, and a friend of mine who's a surgeon in Sion, he contracted the virus. His mother is on chemotherapy; she's immunocompromised, so she was in the ICU for a good 10 days, and it was a very harrowing experience for him as a doctor, because he was the one who
I
got
know.
the virus home from a patient. And a friend of mine had a heart attack. Like at our age, having a heart attack is something so
It's
unheard of.
I
Uh,
know.
all because
I
of the COVID. So
And I know I've been hearing some of the stories through you. We did a series on how
yeah, yeah, yeah. That was such a
uh,
nice initiative
yeah.
on your part.
Thank you for that, and thank you. I'm glad we could bring out those stories. That's something we should revisit, time and again, because the kind of messages the doctors gave us was important, and we need to keep that in our minds because
Yeah,
now our guards are down basically because
yeah.
everybody's and tired of this pandemic. But then there are people like you who are, battling it every single day, and the threat is no less now than it was before.
Yeah, it's no less, and in fact, sometimes I feel it's more now because that comfort has set in.
Yes.
That
Yes.
people have
True.
become very complacent about what that the pandemic is here to stay, and we just have to live our lives and carry on with it. So, in fact, we're expecting a huge case surge in the winter, especially for pediatric patients, because pediatrics, the number of respiratory tract infections goes up in the winter as it is. We get a lot of pneumonias and a lot of bronchitis, asthma. So we're expecting that with COVID being primarily a respiratory virus, we're
Hmm.
expecting like a huge surge of cases in the winter. So we are trying to, wrap our heads around that, and we're trying to
Hmm.
just, see
Right.
what are the contingency measures that we can take, and how can we, do anything for
Right.
protecting ourselves.
Right. Just preparing for that peak
Yeah,
cases.
yeah, yeah.
Um, Radhika, I'd like to ask you, what's the best and what's the worst part of your job?
So the worst part of my job, of course, is losing patients. That's a very obvious scenario, because I work with children, and when an old person dies, of course, it's very sad. But somewhere, if the person is in their 80s or 90s, they've lived their life, they've spent time with their grandchildren, so they've completed their uh, time on earth. And when a child dies, it's just so traumatic that this child could have grown up, he could have done so much, and for the parents, it's just devastating. And when I look at those parents, I feel pretty devastated myself, because
Hmm.
I just start putting myself in their shoes, and I start feeling that, oh my God, if a doctor were to come and tell me someday that, this your child is no more, I would just want to uh, that doctor's face I'll never forget. And that's the worst part of my job, having to break the news that your child is no
Oh my
more,
God.
and we tried all we could, but we couldn't save your child. So that
Oh
is the
man.
worst part of my
I
job,
can't, yeah,
and
I mean, I feel so,
I don't
there's
ever
no
want
one to me right now that
that's
could share that.
yeah, that's the
Yeah.
kind of fate I would never wish on even my worst enemy, to be very honest. It's not a
Yeah.
nice place to be in, and it's definitely not easy. So that is the toughest part. And for the next few hours, you're just in this weird zombie kind of zone where you're just numb. You just can't process what's just happened, and when you go home, you wash off the day, and then you realize, something bad did happen.
Hmm.
Of course, with time, you do get the hang of adapting to those emotions as well. But it never really gets easy. Like I've heard from really senior pediatric
Of course.
intensivists who've also said that it never gets easy as much as you want it to. So that's the
Hmm.
worst part. And the best
I'm
part, of course, is the
sharing it.
exact extreme of that. When a patient gets okay after a while of struggling and being in the hospital and getting those needles and all poked in for a good a number of days, and he came in a very sick condition, and now he's being discharged with this huge smile on his or her face. And with kids especially, they're so cute, like they'll come and they'll hug you, and they'll say ma'am aap kyun ja rahe ho, aap mat jao, like they'll be very loving. So that is I think that is the best part of my job. Kids interacting with the children when they feel better. That is the best part of my job. It's a lovely experience.
Thanks for
They
sharing
are
that.
finally they are
Yeah.
pain free after such a long period of suffering. That feeling is very good. And then
Hmm.
sometimes like usually as a doctor, it's a pretty thankless job. Like you must be reading in the papers and everything. We're getting beaten up.
Yes.
Bad things happen all the time. But then
Yeah.
every 6 months or so, one parent or one patient will come and say that, you know, we had just heard that doctors are akin to God, but today we've seen it as well. मतलब they say it in Hindi कि हमने सुना था कि doctors भगवान के जैसे होते हैं, but आज हमने देख भी लिया. So these
That's
kind of
wonderful.
comments you get once in 6 months, and that kind of gratitude again, like I said earlier, it's overwhelming. So
I can really imagine. And you make me feel all of this as I'm listening to you.
अच्छा.
Hello,
That's
my
nice.
eyes are
I'm trying to put
watering.
it that way, so that you can feel my
It's the way you talk.
yeah.
And yes, it's wonderful to hear this. It's also quite sad to hear the distressing bits, but it's reality.
It
Uh,
is.
what's the important quality in you that's seeing you through this tough time of a pandemic?
So I think an important quality in me. So I'm not a very, emotionally strong person, like you would have noticed by now. Um, I'm very empathetic, and I'm very scared. I would say I have that
I would
element
argue
of.
that makes you emotionally strong.
Does it? Okay, so I know, but I worry all the time, So I'm
Okay.
constantly worried about catching COVID, and I get
Hmm.
tested almost every 2 weeks just for being, aware of whether or not I have it. So that I think the only quality which actually gets me through is maybe resilience, because I've had a bunch of tough experiences in my childhood. When I was unwell as a child. I had this tuberculosis and a lot of things. So I think resilience is one of the qualities that is helping me through. And of course, the charity work that I do, it really helps me. I think um, that is the one thing which has gotten me through it all. So
I
keeping
see.
my mind occupied and busy all the time. Like I'm continuously, like even when I'm not at the hospital, I'm working on the foundation at home, and I try to keep myself engaged and busy all the time. And I just like to mention that I have the best friends in the universe. Touch wood for them, and I'm very blessed that way. That my support system, be it my family or my friends, they're just the most amazing group of people that I think they are my biggest blessing, and my the kind of bond that I share with them is also another thing which really keeps me going every day.
That's great to hear that. And
Yeah.
if you would like to leave people with a message, what would that be?
So I just like to leave them with one message that times are unbelievably difficult and they're going to be difficult for a while more. So just stay strong, focus on your mental health, and even though we can't stop people from dying, we can really help those who are worst affected. So try and do your bit in that as much as possible, because that will give you a lot of satisfaction as well. And aside from that, just stay put. There is a lot of bad in the world, but then there's a lot of love in the world as well. And I feel like the love is going to get us through it. So yeah, that's my message.
It was a pleasure, absolute pleasure, Radha, talking to you, because it's true that empowered women empower others, they empower communities, and you're doing just that. So thank you
Thank
so much for
you.
your work.
Thank
Thank
you
you
so
so much.
much for